Atrial flutter is rapid regular atrial depolarization from a macro reentry circuit within the atrium, most commonly from right atrium. We can see this in ECG as atrial rate 250 to 350 beats per minute, narrow QRS complexes, sawtooth waves. It is common in patients with high blood pressure and cardiomyopathies, and it is less often present in patients with coronary artery disease, thyrotoxicosis, mitral valve disease, and history of cardiac surgery. Symptoms may include palpitations, either heart is racing too fast or skip beats, chest discomfort, difficulty breathing, lightheadedness, loss of consciousness. Treatment is if patient is unstable, meaning hypotensive or having congestive heart failure, angina, there is a need to do electrical cardioversion. If patient is stable, then first thing is to control the rate by giving beta blocker or calcium channel blocker. Chemical cardioversion with antiarrhythmatics such as sotalol, amiodarone, or type 1 antiarrhythmatics, or it can be done by electrical cardioversion. Anticoagulation such as warfarin to prevent blood clot. Patient may need further treatment such as ablations. It may be used to destroy some tissues in the heart to prevent abnormal firing. Atrial fibrillation is rapid, irregular beating of the atrial chambers of heart. In atrial fibrillation, the normal regular electrical impulses generated by the sinoatrial node are overwhelmed by disorganized electrical waves usually originating from the roots of pulmonary veins. These disorganized waves conduct intermittently through the atrioventricular node, leading to irregular activations of the ventricles. ECG shows atrial rate 350 to 600 beats per minute, no organized P wave, narrow or wide QRS complexes. Causes of atrial fibrillation include high blood pressure, valvular heart disease, heart failure, coronary artery disease, cardiomyopathy, congenital heart disease, COPD, and sleep apnea. Patients are either asymptomatic, and if they're symptomatic, they may feel palpitations, fainting, lightheadedness, shortness of breath, chest pain. Atrial fibrillation is also associated with increased risk of heart failure and stroke. The primary goal to treat atrial fibrillation is to control the symptoms. All patients should be evaluated for stroke risk and receive anticoagulation. If patient is unstable, such as patient has hypotension, angina, or uncontrolled heart failure, then there is a need to do immediate cardioversion. If patient is stable, then there is a need to control rate by giving beta blocker and calcium channel blockers such as diltiazem or verapamil. Anticoagulation is done by warfarin or direct oral anticoagulants. If atrial fibrillation is for 48 hours, anticoagulate the patient for 3 weeks before and 4 weeks after cardioversion due to risk of unstable intra-atrial thrombosis. Surgical management of atrial fibrillation is to do the ablation. Thanks for watching. Do not forget to like, subscribe, or comment.